Hi, I'm Ken Smith. Welcome to the Environmental Health and All Policies Toolkit. I'm going to give a brief overview of what Health and All Policies is, and then my colleague Rebecca Johnson is going to give you an overview about the toolkit and how to use it. For the National Association of County and City Health Officials, HiAP is a change in the systems that determine how policy decisions are made and implemented by local, state, and federal government to ensure that policy decisions have beneficial or neutral impacts on the determinants of health. So remember, Health and All Policies is HiAP or high up, meaning the idea of Health and All Policies is really to address the environments where people live, learn, work, and play. Here are several tactics to implement Health and All Policies in your jurisdiction and ultimately in adjoining jurisdictions and at the regional and state level. The first is developing and structuring cross-sector relationships. You're going to be working with a wide variety of people outside of the health field. And so you're going to have to start to build some relationships and communicate with them in a way that would basically enable them to want to ensure that there's health considerations during their decision-making processes. And that relationship building takes a long time. Incorporating health into the decision-making process. This is where Health and All Policies differs a bit from health impact assessment. Health impact assessment is a tool for uncovering the health impacts of policies, programs, projects, and plans that have already been made, so that once these health impacts are uncovered, that proposed policy, plan, or program could be modified potentially before it's actually implemented, and then maybe monitored as it's implemented. Health and All Policies, on the other hand, is even farther downstream. It's more of a systems change that ensures that when those policies, programs, or services, or whatever are being formulated, health considerations are made by those decision makers, those planners, and so forth. Enhancing the workforce capacity is another tactic for helping to implement Health and All Policies. The idea is that you want your local health department staff to have some kind of understanding about how to speak the language of these other sectors. They may need to know something about planning or something about transportation planning. They need to know about these things when they're meeting and talking to these other sectors. On the other hand, you may want those other sectors to have some kind of understanding about health. So there's an important labor component and training component to implementing Health and All Policies. The other tactics include coordinating funding and investments, integrating research, evaluation, and data systems, synchronizing communications and messaging, and implementing accountability structures. You can make this happen. Local health departments have the opportunity to build a movement from the ground up to help to implement Health and All Policies, not just in your own jurisdictions, but across jurisdictions, regionally, at the state level, and ultimately nationally. I would highly encourage you to first read NACCHO's policy statement on Health and All Policies, which recommends and gives you the backing of the National Association of County and City Health Officials, backing for your local efforts to make this happen in your jurisdictions and beyond. And now for an introduction to the NACCHO Environmental Health and All Policies Toolkit. Rebecca Johnson.
Thank you, Ken, for that great introduction. In order to access our toolkit, what you want to do is you want to visit the NACCHO main page. So you just go to www.naccho.org. And then in order to access our toolkit, you go to Toolbox, and then you'll scroll down. Now here you have the option of just typing in a keyword. So for example, you could type in Health and All Policies and you'd get a whole list of Health and All Policy tools. You could also say you're interested in searching for how to utilize the accreditation process to advance Health and All Policies. If you typed accreditation in here, you're going to see all the accreditation tools. You're not going to see, the Health and All Policies and accreditation tools will be in that list, but that could be buried several layers deep. So in order to make sure that you're accessing the Health and All Policies toolkit, what you'd want to do is go browse by toolkit. And this will take you to the list of all of our toolkits. We have several toolkits on everything from accreditation to climate change to food safety, and whatnot. So under environmental health, you'll see the Health in All Policies Toolkit, and you can select that. Once here, if you typed in accreditation, now this would take you specifically to the tools that are related to advancing health in all policies through the accreditation process. The other option is you could just generally browse through the tools by alphabetical order by selecting Browse by Tool Name. Now here all the tools are listed, and they're listed in alphabetical order. Now some of our tools are organized to give basically a general overview of what health in all policies is. For example, under D we have the discussion paper on intersectoral action on health. This is a great, short, concise overview of what health in all policies is and what kind of steps you can take to advance health in all policies in your jurisdiction. It provides some case studies. It's 14 pages, it's very easy, it's very quick, and it's a great introduction that you can share internally and externally. And to access it, you would just click over here, discussion paper, and that will allow you to read the tool, print the tool, whatever you would like to do with the tool. So some of our tools are also seek to address specific risk factors using a health in all policy approach. For example, if you wanted to address obesity by increasing physical activity and increasing access to nutritious food, you could go to our Action Strategies Toolkit right here, which is a guide for local and state decision makers on how to create healthy communities. This is a great guide. However, it does not specifically mention health in all policies, but it does concentrate on multi-sectoral activity around bikeability, walkability, access to nutritious food. It talks about working with your transportation department. And it's really working towards a health in all policies approach to address these individual risk factors. Lastly, we also include tools that are skills-based. So if you go back to the full list and you click on what surrounds us, shapes us, and what it does is it helps public health professionals learn how to frame messaging around health issues and to communicate with local decision makers, with local policy makers, and the general public. Now this is a set of skills that are very valuable when trying to advance a health in all policies approach that can be utilized to educate community members on why health in all policies is a good approach to systematically address health inequities and the social determinants of health in your community. We also want to encourage you, as you're going through the toolkit and using different tools, we really would like to strongly encourage you to rate the tools. And you can do that by selecting the Rate It feature, which is below every tool in the toolbox. And when you do this, this allows you to give your rating. You can give it a stars out of 5. And then you can also write a comment about what you found useful or not useful about the tool. We strongly encourage you to do this because for those tools that are beneficial, we want to make sure that we highlight them and promote them to other local jurisdictions promoting health in all policies in their communities. For those tools that perhaps are not as useful, we would like to know so that we can refine the toolkit to make sure that this is always a high quality, very usable toolkit. The other thing is if you're working to advance health in all policies in your community and you've developed some success stories, presentations of some kind, and you think that other local communities would benefit from the resources that you've developed to educate your community about environmental health in all policies, we strongly encourage you to upload those tools by clicking Submit a Tool. You will want to make sure that you select the Health in All Policies Toolkit so it's housed in the right location. And then this will take you through the entire process. Once you've uploaded it, we here at NACCHO will internally approve it, and then it'll be uploaded and live and available to other local jurisdictions who are using the NACCHO toolbox. So with that, I'm going to hand it back to Ken, who will provide information on how to contact us. Thank you.
Thank you, Rebecca. That was an excellent introduction to the toolkit. For more information about NACCHO's toolkit for health in all policies and other information about environmental health in all policies, please go to NACCHO's website at www.naccho.org, topics, environmental health, HIP. For more specific questions about how NACCHO can help you in your efforts, or if you'd like to share your experience with those efforts, please email us at hiap@naccho.org. Thank you very much for watching this introduction. Good luck.